This presentation is on Parkinson's disease by Shannon Dorchak. Parkinson's disease is a neurodegenerative disorder that affects predominantly dopamine-producing neurons near the basal ganglia where cells produce dopamine. It is a slowly progressive neurodegenerative syndrome affecting movement and gait function in the early to mid stages of the disease and cognitive function in the later years of the disease. The purpose of this presentation is to discuss what Parkinson's disease is, what it affects, and how the symptoms can be treated. Prevalence and demographics of Parkinson's disease. According to the Parkinson's Disease Foundation, Parkinson's disease affects about 1 million people in the United States and more than 4 million people worldwide. About 60,000 people are diagnosed each year in the United States. The disorder occurs in all races, but Parkinson's is somewhat more prevalent among Caucasians. Men develop the disease slightly more often than women. Parkinson's is rare in people under the age of 30, and risk for the disease increases with age. It is estimated that 5 to 10% of the patients who have Parkinson's disease experience symptoms before the age of 40. Parkinson's disease is common in the elderly and affects 1 in 20 persons over the age of 80. Risk factors of Parkinson's disease. Many studies have identified that the incidence of Parkinson's disease is more common in men than women. The reasons for the differences in men and women with Parkinson's disease are unclear, although one suggested explanation is the protective effect of estrogen that women have. Other theories continue to explain the difference between Parkinson's disease in men and women, including the higher rate of minor head trauma and exposure to occupational toxins in men and genetic susceptibility genes on the sex chromosomes. According to Mock, approximately 15% of people with Parkinson's have a relative with the disease. While some cases of Parkinson's disease occur in families, 85% of the cases are sporadic, meaning they occur without an identified inherited genetic predisposition. Several genetic mutations have been identified that are associated with Parkinson's disease. Pathophysiology of Parkinson's disease. Dopamine depletion from the basal ganglia results in major disruptions in the connections to the thalamus and motor cortex and leads to Parkinsonian signs such as bradykinesia, rigidity, and loss of automatic movement. Signs and symptoms of Parkinson's disease. Tremor. A tremor or shaking usually begins in a limb, often your hand or fingers. You may rub your thumb and forefinger back and forth, known as pill rolling tremor. Your hand may tremor when it's at rest. Bradykinesia. Over time, Parkinson's disease may slow your movement, making simple tasks difficult and time-consuming. Your steps may become shorter when you walk. It may be difficult to get out of a chair. You may drag your feet as you try to walk. Rigid muscles. Muscle stiffness may occur in any part of your body. The stiff muscles can be painful and limit your range of motion. Impaired posture and balance. Your posture may become stooped or you may have balance problems as a result of Parkinson's disease. Loss of automatic movement. You may have a decreased ability to perform unconscious movements, including blinking, smiling, or swinging your arms when you walk. Speech changes. You may speak softly, quickly, slur, or hesitate before talking. Your speech may be more of a monotone rather than the usual inflection. Writing changes. It may become too hard to write and your writing may appear small. Parkinson's disease. As the disease progresses and complications arise, patients inevitably require subspecialty care and treatment. In the later stages of PD, even the most advanced measures fail to relieve disabling symptoms, and the management becomes centered on palliative care. Throughout the entire disease course, ancillary specialists such as physical therapists, speech therapists, and mental health professionals play pivotal roles in assisting in the care of patients with PD. While there are no current treatments that stall this process, many of the motor symptoms can be treated with medications and procedures that activate dopamine receptors within the brain. It is also clear that in treating the motor symptoms of Parkinson's, it is possible to forestall functional disability and dramatically improve mortality. Prior to the discovery of levodopa in patients with Parkinson's, most individuals with the disease died within 5 to 10 years of disease onset. Today, with symptomatic treatments, many patients with Parkinson's disease can expect to live close to a normal life expectancy for their age. Assessment tools to detect Parkinson's disease. There is no single test that can diagnose Parkinson's disease. If Parkinson's disease is suspected in a patient, they should be referred to a neurologist, specially trained in movement disorders. The neurologist will look for cardinal symptoms during the assessment. PD is challenging to appropriately diagnose. 5 to 10% of the patients with PD are misdiagnosed. Current diagnosis is made through the presence of motor symptoms. However, researchers have found that by the time motor symptoms occur, over 60% of all dopamine neurons in the basal ganglia of the brain have already been damaged. Non-motor symptoms become apparent in people with Parkinson's disease long before motor symptoms, including sleep disturbances and loss of sense of smell. Diagnosis of PD is generally made using a medical history and a physical exam or a neurological exam. According to mock imaging such as MRI, PET scans, or DAT scans are expensive and they're not routinely used. Parkinson's disease. Medications are most common for Parkinson's. The goal is to correct the shortage of dopamine. It is deficiency that causes the symptoms. Pharmacological treatment is usually started when symptoms become disabling or disrupt daily activities. Treatments may differ according to the patient's symptoms, age, and response to specific drugs. It often takes time to find the best combination of drugs for each patient. Education, follow-up, and supportive resources are often offered to the family and the patient. Parkinson's disease has been plaguing humans for thousands of years. Parkinson's disease is increasingly becoming the second most common neurological disorder observed in the elderly population. Age is the greatest risk factor for developing PD, and with increased longevity in the population, PD incidences are destined to increase. Every patient with PD is unique, and as more drugs, devices, and techniques are being developed, individualized treatment plans will continue to be the physician's main priority.